Hello, my name is Ibrahim Adam. I'm practical nurse learners from Bobari College, and today I'm going to do my nursing lab assessment for Nursing Foundation 3. This is my ID, and this is the back of my ID. And then I'm gonna take like 360 degree where I'm just working. This is the area. This is my table. Okay, then I'm gonna show you like all my papers are not pre-written things on it then. Okay, so my labeling, they are not written on it. Okay, so the next step is I'm gonna start. First, all my supplies are here. Mini bag, secondary IV line, my syringe and needles, my medication, sharp container and sanitizer. Here is my patient. Okay, so I'm gonna start by hand sanitize. Do until it's dry. Then I will just start by reading scenario. Okay. Chinook Allison, date of birth 1960, December 11, ID number 6149733042. Allison Chinook is a patient who has been admitted with urothelial carcinoma requiring chemotherapy and pain management. The time is 1500 and Allison is due to receive an antiemetic 6 hours after the first scheduled chemotherapy. Okay, this is my scenario. Put it away. And then after that, I'm gonna compare my doctor's order with the MAR. Okay, this is my MAR. This is my doctor's order. From doctor's order, Chinook Allison, hospital ID 6149733042, hospital ID 6149733042, date of birth 1960 December 11, date of birth 1960 December 11. Today's date is October 20, 2020, time is 1500. From the doctor's order, admission diagnosis, it is urothelial carcinoma, visit reason, chemotherapy, symptom management, allergies, no known allergies. And from doctor's order, I have dexamethasone, 4 milligram IV piggyback every 6 hours after chemotherapy, and the status is active for today. Okay, from the from the MAR, I can see dexamethasone 4 milligram IV piggyback every 6 hours after chemotherapy, and time is 1500. The reason is for antiemetics. So I just compare both and it's the right order. I'm gonna put the doctor's order away. Okay, so the next step is I'm gonna just do my 3 checkings on with my monograph on my mini bag solution. Okay, so all are my supplies. My syringes all are not expired, but my syringes are just used. Most of them are used one. I'm just reusing them. They are not intact. And this is my mini bag solution. It is clear, no precipitation. And I'm gonna do my 3 checking with the monograph. Okay, this is in my hand. I have 0.9% sodium chloride solution, 50 ml. Expired date is March 21st. The reason for use is for dilution of medication. For the monograph, dexamethasone intermittent IV infusion. For the solution is for normal saline, and volume is 50 to 100 ml over 20 to 30 minutes. And reason is for dilution of medication. My first check is done. My second check, I have 0.9% sodium chloride, 50 ml, and expired date is March 21st. The reason why I'm just using is for dilution of medication as intermittent IV piggyback. And from the monograph, normal saline 50 to 100 ml over 20 to 30 minutes, and the reason is for the addition of medication as intermittent IV piggyback. Okay, I have done my second check. Mass charge check. In my hand I have 0.9% sodium chloride, 50 ml. Expired date is March 21st, and the reason is for the addition of medication as intermittent IV piggyback. From the monograph, I have normal saline and 50 to 100 ml over 20 to 30 minutes. The reason is for the addition of dexamethasone as intermittent IV infusion. Okay, I have done my 3 checkings. The next step is I'm gonna just go and do my first check of medication with the MAR first check. Okay, in my hand I have dexamethasone 4 milligram per ml. Expired date is 2030 October. It is 10 ml. And from the MAR I have chinocalicin, ID number 614973042, date of birth 1960 December 11. Today's date is October 20, 2020. Time is 1500. And there is no patient information on this one because this is stock medication. And over here I have dexamethasone 4 milligram IV piggyback every 6 hours after chemotherapy. And the reason why I'm just using is for antiemetics, and the reason why I'm just using this medication is also antiemetics. The expired date is 2030, which is good to use. So I've done my first check. Okay. After I have done my first check, I'm gonna do medication calculation and take a look for medication information, further information on the dexamethasone. So dexamethasone, we can just give it a route of like direct IV, intermittent IV infusion. Yes, so that is the one we are just going to use it. Indication for the parenteral use for prevention of chemotherapy induced nausea and vomiting. That's the reason why I'm just going to use it. Dosage is for antiemetics 8 to 20 milligram before chemo, then 4 milligram every 6 hours. So I'm going to give 4 milligram every 6 hours. And administration, I can give IV infusion over for 50 to 100 ml mini-bag infuse over 20 to 30 minutes. So that is the one I'm just going to use it. Reconstitution 4 milligram per ml, that is availability. That is one on also 4 milligram per ml. And dilution, I can dilute it in normal saline, like the same way I just explained already. So what I'm gonna do is what the order is from the MAR. It is 4 milligram IV piggyback. Order is 4 milligram. And what is the availability? It is 4 milligram per ml. So how many ml do I need? So crisscross is gonna be 1 ml. So I need 1 ml of normal saline. And the next step is the amount of solution is 50, so I'm going to use it. I'm going to use it over 30 minutes, 50 ml. And the other thing is about side effects. So side effect, it is cardiovascular. It can cause hypertension, transient hypotension, congestive heart failure, edema, hyperglycemia, weakness. Dermatologically, it can cause fatigue, ecchymosis. It is contraindicated for systemic fungal infection, for hypersensitivity to dexamethasone and hypersensitivity to sodium sulfate or benzyl alcohol. And we have to monitor baseline for potassium, glucose, and fluid balance over and daily weight. Okay, so I have just gathered all those information. So the next step is I have done my first check. The next step is I'm going to just withdraw my medication. Okay, to withdraw my medication, this is my 3 ml. It is not intact because I have used it before, and expiry date is 2025, and this is my syringe needle. It is blunt fill needle. It is not intact because I have opened it or used it before. Expiry date is 2025, which is good to use. Okay, so I'm gonna clean my medication for 30 seconds. 25, 26, 27, 28, 29, 30. Okay, put it away. Okay, because this is vials, I'm gonna just add 1 ml, the amount that I want to just withdraw of air. Okay. Remove air. Okay. Okay, no air bubbles, and this is my 1 ml. Okay, so I'm gonna recap it. Then do my second checking. So my second check with MAR, patient name Shunuk Alison, ID 6149733042, date of birth 1960, December 11, today's date is October 20, 2020, time is 1500, and there is no patient information on my medication, but in my hand I have dexamethasone 4 milligram per ml, expiry date is 2030 October, which is good to use. It is 10 ml. There's no patient information because this is a stock medication. From the reason why I'm just using is for antiemetics. From the MAR, dexamethasone 4 milligram IV piggy bag every 6 hours after chemotherapy, and the reason is for antiemetics, and time is 1500. And I have to just hold it both together. Sorry, I'm gonna redo it. It is dexamethasone 4 milligram per ml, expiry date is 2013 October, which is good to use, and 10 ml. And in my hand I have 1 ml of dexamethasone. There's not patient information on this one, and I'm going to use it for antiemetics. From the MAR, I have 4 milligram IV piggy bag every 6 hours after chemotherapy, which is the same as 1 ml, and the reason is for antiemetics, and time is 1500. So I have done my second check. Okay, now I'm gonna just clean my medication, my mini bag, and put my medication inside. Add it. Okay, for 30 seconds. 25, 26, 27, 28, 29, 30. Okay. Then I will just remove it and put it. I don't know if this is going to be visible for you. Go directly to the chart. Okay, then mix it gently. Then write down the labeling. I'm gonna write down the labeling from the medication. So in the MAR, patient name is Shunuk Allison. ID is 61 49 7 3042, and medication is dexamethasone. So 4 milligram per 50 ml, IV PG bag, and date is 2020 10 20, time is 1500, and added by me, which is initial Ibrahim Adam, and PNL. This is my labeling. Okay, then I'm gonna label my medication. This is the label of my medication. And so the next is I'm gonna go to my patient room. Okay, so to go to the patient room, and I wanna just check like my compatibility, because I'm going to do for dexamethasone. So primary solution is normal saline IV continuous at 10 ml per hour. So dexamethasone is it is compatible with 0.9% sodium chloride, so it is good. So I don't need this one. I'll put it away, and I have my MAR, my monograph, my paper in case I don't need it anymore, and my medication, my secondary IV tube, which is this one, and my alcohol swab, and where is my secondary line, secondary line. Sorry, it's here. Just put it away. So my secondary line, and I'm gonna go to my patients. Okay, so I'll just push it with this one up and do hand sanitize. And then go to my patient. Here is my patient. Knock, knock. Hello, my name is Ibrahim Adam. I'm practical nurse learners from Bobali College, and today I'm here to just give you or hand your IV medication. Okay, can you please spell your first and your last name and date of birth? He said Shunuk Allison, December, date of birth 1960, December 11. I have to check it with ID band, which is Shunuk Allison, and hospital ID 614973042, hospital ID 614973042, date of birth 1960 December 11, date of birth 1960 December 11. Okay, so the right patients. So after that I have to just move the bed to the working height, and I have to give privacy and break the bed. And then the next step is I'm gonna just do assessments. First, assessing for the patient's IV line side. So the dressing was changed today. It says October 2020 and October 2020. Time is 7 in the morning, and it is changed by me, Ibrahim Adam, PNL. Okay, There is no any tenderness, edema, or ecchymosis around the IV line. There is no any discharge, or there is no any fluid coming through the IV line. And the other thing is I'm gonna check for any air bubbles, starting from the bottom to up. No air bubbles, no air bubbles, no air bubbles, and the primary fluid is just dripping. Okay, so that is good. And primary bag was changed today, date of 2020, to October 2020, which is today, and the time is 7 in the morning. It is changed by me, and it's normal saline. Okay, so the next assessment is I'm gonna assess for allergic. Hello, Mr. Allison. Do you have any allergic? He says no. I already checked. He has no known allergies. Do you have any allergy? Do you have any allergy to dexamethasone? No. Do you have any allergy to benzyl alcohol or sodium sulfate? He said no. He does not have any allergy. And I asked him also if he has a systemic fungal infection. He said he does not have any systemic fungal infection, and which is contraindication for dexamethasone. And another assessment is I have to check for the baseline for potassium, glucose blood level, and for fluid balance, and daily weight, because this can cause like edema, which can change the weight, and it can cause congestive heart failure. So we have to monitor his fluid balance, and it can cause hypertension. So I'm gonna also ask him if he has any symptoms of hypertension, like headache, blurred visions. He said he does not have it. And another thing is, do you have any edema? He does not have any edema. And do you have any signs, symptoms of hypokalemia or low potassium level, like confusion, lethargic, dizziness, tachycardic, tachypnea? He said he does not have any of the symptom. Okay, that's good. And then the next step is I'm gonna do my third check. So third check with the MAR and my medication from Minibag. Patient name is Shunuk Allison. ID 6149733042. ID 6149733042. Okay. Medication is dexamethasone 4 mg per 50 ml, because it is in 50 ml. So over here it says dexamethasone 4 mg IV piggy bag every 6 hours after chemotherapy. Okay, it's the right one. And today's date and time, date is 2020, and October 2020, time is 1500. Over here date is 2020, October 20th, time is 1500. And the reason why I'm just giving this medication is for antiemetics, and there is my designation, initial designation. Okay, I have done my third check. So the next step is I'm gonna hang my medication. To do that, this is intact, so I'm gonna open it. Okay, hold the two tips. Hold the two tip, remove this one, hold the two tips, and then move the primary solution first. And then prime this medication. I'm gonna hang it. Here, then clean it. For 30 seconds, 25, 26, 27, 28, 29, 30. Put it away, and then to just show you. Open it without not touching it. Okay. I have to close this one. Should be closed. Okay, then prime it for the. I'm gonna prime it like 1/3. Close this one and open this one. Okay. Okay, now it's primed. So the next step is I'm gonna just spike it because I have already spiked it. So I'm gonna remove it, put it away, open, remove the spike. Okay. Then I have to just open this one all the way and then close this one, monitor with this one, hang it. So the next step is I'm gonna just do so I'm gonna flow in it 50 ml over 30 minutes, so that is the rates. And the next one is I have to just do my secondary line. There is 20 20 10 20. Line time is 1500. Initial Ibrahim Adam. Line is secondary. Solution is 0.9% sodium chloride or secondary sodium chloride. So this is my, and then I'm gonna just stick it to my secondary line. And then check for the drip when it is dropping. Okay, here we go. To start dropping. So dropping. So I have adjusted it. So now I'm gonna sign the MAR. Here is the MAR, dexamethasone at 1500. So Ibrahim Adam PNL. Okay. So the next step is I'm gonna clean all my stuff and then do hand sanitize and then do my checking. Do my 3 teachings. So my 3 teachings is they're gonna be like, first, let me know if you develop any fever, rash, or hives. That is a sign of allergy. The next one is let me know if you wanna just if you see any leakage of fluids or any edema or redness, ecchymosis, or any tenderness over the IV line side. The third one is let me know if you have any, if you develop any edema, like general body edema, if you have any confusion, fatigue, and headache, blurred vision, because those are the sign of hypokalemia and hyperglycemia. And yeah, those are the sign of also if you have any sign of hypertension, like headache, blurred vision, I said already. So if you want to just move around, please call me. I have to just put your bag on the movable. And here is your call bell. And I just moved the bed to the lowest level. And thank you very much. I'm done.